Settings here. I think we are pretty good. Okay guys, how you doing? Okay, Dr. Adam Tice here for our office hours session. And today I want to do kind of a part two and continue and unpack a little bit of the stuff that we talked about in last week's session. And so the topic is microdosing and healing the mind. And really, there's a couple of things I want to talk about just to kind of round out that idea and just to kind of complete a few thoughts on that topic, because I think it's important to talk about. I think it's important to bring up the topic so you know that it exists, and then also to kind of put it in the proper context and understand that even with plant medicines, you can there's a right application and there's maybe an ideal application or scenario, and then a less than ideal application or scenario that we're talking about. So that's what we're going to talk about and unpack this plant medicine thing a little bit more. So I think it's number one, the plant medicines are super powerful, and we can use these for breakthroughs. And I want to expand out the conversation a little bit. So really we're talking about psilocybin, so magic mushrooms, the psilocybin in the microdose range. So we're really talking about under 1 gram and really in the 50 to 100 milligram range really is more of the micro range. As you move up that range, 300 milligrams, 500 milligrams, up to 1,000 milligrams, which is 1 gram. Then you start to get into more of a pharmacologic territory, so the effect is going to be stronger. So that's a different application. That's more of, and then certainly when we get into those doses of 1 to 3 grams, 3 to 5 grams, above 5 grams, we're in heroes dose territory. You're in ceremonial territory there. You're definitely in psychedelic territory there, and you need to know that. And you really need to be experienced or have someone that is experienced to kind of guide you in that domain. So that we need to respect the medicine. It's strong. It will rock your world if that's what you're looking for. And sometimes that's good, sometimes that's not good. But again, just having this knowledge of the scale and the dose and things like this, some of that, I hope it's not too like technical or anything like that, but it's important. I think it's important to get that little bit of information so you can be empowered about what you're doing. Also in just the general domain of plant medicines, we could lump cannabis in there also as a plant medicine that can be a plant medicine therapeutic, that can be used as an instrument, as a tool to get some kind of a breakthrough in the mind, and again, that is a dose dependent thing. And now that I've just said that, I realize I should probably do a whole session and just do the cannabis focus. So okay, another office hour session, we're going to talk about that, because there's a bunch of you guys that we're using therapeutic cannabis with, and some of the most common things that we're doing that with, the number one thing is probably sleep. Difficulty getting to sleep, difficulty staying asleep. Cannabis can be really, really nice application there. It's not my first go-to, but there's some other things. So then there's a bunch of you guys that are using this therapeutically, and again, there's a right way, an ideal way, and a less than ideal way to use that. So let's keep it psilocybin and one of the stronger plant medicines, and perhaps on the topic of the stronger medicines, just put things like ayahuasca in there also. These things that are truly, they are truly psychedelic, truly mind altering, and they will give you some kind of a breakthrough. And for the right person, in the right ambiance, in the right setting, at the right time, that can be really powerful. Now, before you enter into that territory, you need to figure out, is this something for you? And you need to keep the expectations and the context clear, in the sense that just because we're talking about natural medicine, we're still not really looking for magic bullets. Okay? Um, Magic bullet, different kind of a thing. Okay? So thinking that a medicine, a pharmaceutical, a plant medicine, a therapist, a person, a doctor, a friend, anybody, thinking something or someone can, thinking that that thing or that person can lift you out and transform you by some magic happening, okay, that's faulty thinking, and that's never gonna happen. So if you think that you can take some magic mushrooms and boom, just heal your mind instantly and keep doing that, you're wrong. That's not gonna happen. And if and kind of on the other side, if you think that we don't want to lean on any medicine, natural medicine, supplement, even certainly not pharma. We don't want to lean on pharma or any of this stuff as a long-term, as a crutch, as an assistant, as something that we're gonna have to do long-term and have that as a forever kind of a medicine. That's pharma thinking. Here you have depression. Here is a pill that you can take forever and magically heal you or cure you. Or here you can't sleep here because of your mind, your anxiety, or these different things. Here's some pharma, here's some pill, some potion, some lotion, some something, and you do this forever and you'll be better. It just doesn't work like that. It doesn't work like that in the realm of plant medicines either. And so we want to just keep the proper context. If we're going to be using plant medicines, and I level the playing field when I think about this stuff. Now, whether it's, just if we're talking about just say anxiety or depression, those are two common flavors of moods that a lot of people experience and a lot of people deal with and a lot of people are looking for solutions for. And I kind of keep the playing field. I don't care if we're talking about pharma, or if we're talking about homeopathics, remedies, or if we're talking about supplements, or if we're talking about botanicals, or if we're talking about plant medicines. It doesn't matter for me. The point is we can use those things as tools, as assistants, as allies in a temporary type fashion to kind of to carve out some kind of a breakthrough, to get some clarity, to get some perspective shift that's going to allow you to get a breakthrough and have some different shift, have some kind of a mind shift, so that it will keep you on the path of healing your mind. And healing the mind is something that has to happen every day. We never arrive there. There is no place to get to. There's no destination that we're trying to get to. We're looking for these different assistants, these different tools and techniques and strategies and things to get us to the point where we can digest our daily life in a way that we can also, find some kind of happiness and purpose and peace and equanimity of mind in that. And that so we don't get sucked into, a depression spiral or anxiety spiral or some other, flavor of that, where then the mind is using us. Okay, the mind is a tremendous gift. The brain is a tremendous quantum computing apparatus. And then the mind itself is that greater sense of self, and that we carry with us. That is timeless. And we will carry actually, parts of the mind and these layers of the mind. And Ayurveda talks about this, and the yogic sciences talk about the different layers and the dimensions of the mind. I think this is important to understand. There's a lot of different layers, and and people are complex, and the human being in the system is complex, and there are these many layers, and the mind is timeless. and that we have some ancient tools that we can use, plant medicines and remedies and supplements and herbs and these things. And just as long as we keep proper expectation and proper context with these things, and know that yes, we have some other tools that we can use for when we have big challenges in life, or big transitions in life, and we find ourselves trying to land on our feet, mentally, emotionally, spiritually, and we want to maintain that fitness and maintain that strength. We can use the plant medicines to move us through, and then getting us to that balance point where we're able to kind of use ongoing, less invasive methods like meditation and mindfulness. And there are other tools and techniques and strategies that we can use to to kind of instantly dial into that equanimity, that peace of mind, and find that peace of mind. We want to eventually get to that point where we're not even leaning on any plant medicines or herbs or supplements or remedies. Okay, now there's a therapeutic order there. Okay, so at the absolute bottom of the list, it's actually not even on my list, is pharma. It's not an option really. But if it were on the list and there was a list, it would be at the bottom of the list. And then we would kind of move up these things, then there might be, so we really want to keep in mind, and we want to try and use and remember our therapeutic kind of approach, where we want to use the least invasive methods. We want to use the lowest levels of intervention as possible to intervene and to restore balance and restore an equanimity to the mind. So in this example, it might look like this is following our principles, guys. This is the magic of the minimum. Then this is the ideal, really what we're looking for with all our cases and all our situations. In your situation, you can kind of apply this and think this through. The least amount of intervention, the lowest level of intervention that is possible, and the magic of the minimum. You keep these concepts in mind, and if it's you working through this stuff, great. If you're working with another practitioner or something, be thinking about this as you go through that. And you're like, is this the lowest amount of intervention? Could we intervene at a lower level and try something out? And then work into stronger interventions, right? I wouldn't just take someone off the street and send them into like a full dose psilocybin regimen, okay? That wouldn't make sense to me. And that might work for a small percentage, maybe 5-10% of the population, but for most people, it's not going to be the best thing. That's cookie cutter, and it's not individualizing. We want to start at the least amount of intervention. So basic meditation practices, mindfulness practices, breathing practices, using some of the yogic sciences, and using food as medicine, understanding that food is the mood, and a quiet mind is a reflection of a clean and pure diet that's digesting, because the food is the mood. The food that you eat helps or contributes to the thoughts that you have and the mind space that you create. Okay, so you got to start to think through those levels first. Then we might start to work our way into homeopathic remedies, super low level intervention. Then working into herbal remedies, kind of medium level interventions, and then getting into the nutritionals, the nutraceuticals, the sleep formulations and the supplements and things like that. We're approaching more of a kind of a pharmaceutical mindset, and you can see as we go through that, we go from purely nature cure to really low level intervention. And then we start making our way down through homeopathics, and as we make our way, and then kind of we get into that functional medicine territory where we're giving herbs or nutrients or supplements, this for that. We're giving these different kinds of things, but we might be addressing symptoms or trying to say, oh, here, this magnesium is good for anxiety, or it's a relaxing mineral. Let's use it. Let's use magnesium. Or let's use some nervine formulations where there might be things like, valerian or skullcap or kava or some of the other botanicals that we're using in more of a materia medica, pharmacological, this for that kind of a mindset. That's where that fits in. And then as we move down this, then we get into the stronger plant medicines, perhaps cannabis, and then we start making our way down, where we might need to use some stronger level interventions. And this is where I would put the psilocybin, keeping in mind that it is designed to be used in the minimal amount possible to get the desired outcome. So if you need a breakthrough, maybe one session of a plant medicine gives you the breakthrough. Okay, that's good. We don't need to lean on that and go do that once a week, or think that we need that every day, or think that that's part of the thing. That's another type of addiction that the mind's just going to latch onto and think that it needs it, just like it gets addicted. I hear people that get latched to their depression. They say, my depression, my anxiety, you fill in the blank DSM category, DSM diagnostic, label, whatever that was, my diagnosis and my medication. And people get really, 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 really hooked on this out there in the world. And there's a lot of this going on. And again, remember, the meds and the stuff that they're using for depression, anxiety, and all these drugs, these are dangerous drugs. And that's not just because I'm the naturopathic doctor saying that. It's like, no. Actually, look at the insert on these drugs, especially the SSRIs and the benzos and all these. The SSRIs, these drugs, they have black box warnings on them. That means on the insert they say this actually makes your condition worse. And so many people don't know that, and so we need to just kind of be aware of this kind of stuff as we're thinking about how do we heal the mind, what's our therapeutic order. If we're thinking about using plant medicines, what's the right context to think and to utilize the plant medicines, and we still keep this magic of the minimum and using the least amount of force, the lowest levels of intervention possible. We got to do that, because that's how we roll. That's how I roll. That's how I work with my patients doing this stuff. And I've been doing this a long time. We see this, and you see what works, and ultimately we are playing the long game. We're not looking for a quick fix. We're not looking for like a wham bam, here's a magic thing that's gonna feel like it works instantly and kind of get your hopes up or whatever, and then it works for 2 days or 2 weeks or maybe 2 months, only to return to the baseline status or worse, or backslide into some different territory. And then again, we're kind of back at square one of the drawing board. And so the mind is a big deal. And think if the mind stuff and the mind needs to be healed, because there'll be some disturbance in the mind fields before it makes its way or manifests in physical symptoms. So if there are only mind symptoms, that's a good place to be. And some people, there's a susceptibility part there also. Some people are just more susceptible or more prone to anxiety, depression, OCD, you fill in the blank, right? It might be in your family. Maybe there's a genetic kind of a momentum. Maybe, maybe that's what you saw growing up. Maybe that's how things were modeled for you as a child growing up. And again, the mind is really sensitive, highly suggestible, and the situations, the experiences, circumstances that you find yourself in as a child, usually, 3, 4, 5, 6, 7, those are when your root patterns get set. That's where it all begins. And if you have some trauma in your life, and again, when I work with my one-on-one patients, a lot of times what we end up doing at some point in our work together is tracing that back and then healing that timeline, finding where that initial fragmentation happened, and then you kind of put the pieces back together and you return to wholeness. And that's kind of what this whole thing is really the return to wholeness and the return to balance, the return to equanimity. If we have a healthy mind, chances are much better that you're going to have a healthy body. I mean, other people have issues with their body and they got really strong, balanced minds. Okay, that's great. It doesn't always have to be this sequential kind of a thing. Like if there's some issue in the mind, then there's some issue in the body. It's not, so straightforward or black and white like that. But just to say, sometimes there is a mental component to many physical conditions. For example, the best example, digestion. Many people I see also present, if there is an anxiety component or a mind component, that might not even get them in the clinic. That might not even get them, working with somebody like me or me. It might be it's usually the physical symptom that's the driver, right? The digestion, the gut goes offline. Then they start getting this kind of irritable gut, irritable bowel type, symptom. And then start getting digestive symptoms and stomach aches or changes in bowels, constipation, diarrhea, alterations in bowel habits or pains or things like that. And that is often a motivator to get someone into the clinic. And then when you actually start taking that case and unpacking that, you find that there's a real strong mind component there too. So we may use plant medicines, in the right, for the right person, because it's not a cookie cutter thing, but for a lot of people, this can be a good tool to get a breakthrough in the mind and start to digest your life and digest your reality, so that it doesn't trickle down and turn into, physical digestive ailments or some other kind of physical issue, that then just complicates the case and complicates your life more. You want to nip it in the bud. You want to try to heal the mind using the least amount, the lowest level of intervention, looking for the magic of the minimum. That's how this works, guys. So just kind of wanted to finish our conversation on the plant medicines and, give the proper context about who may be a candidate for using these things. And if you think you're a good candidate, then keeping it and maintaining the proper context, because remember, we're borrowing these plant medicines from ancient cultures that lived in a completely different time. Lifestyle, everything about it, culture, society, life, daily life, family life, community life, everything was completely different. If we're looking into the lens of some of these cultural plant medicines like psilocybin that some of the indigenous cultures use, like like the ayahuasca that some of the traditions use, psilocybin, these kinds of things. They lived in completely different cultures that were completely different times. So we need to know that we're kind of stepping across the timeline, and we need to do that respectfully, and we need to step into that and kind of bring that wisdom across the culture and across the timeline. We need to try to keep that intact and use it at least with the intention as it was intended. Maybe we don't have the exact ceremonial processes and things like this. I think there are people and places and things that are actually doing this. Okay, this has become trendy. It's like what would you call it? Like psychedelic tourism. I mean, there's a lot of people that they go to the Amazon, they go to these different places, and there's even places around here where you can go to some place or facility in a controlled environment, and that is going to try to set the stage and the ambiance and with some cultural respect, and try to bring that plant medicine, that wisdom across the timeline, across the culture into this modern world. that we have and try to get that benefit. And I think as long as we have that understanding and we have that intention and we have that kind of respect there that's built in for that, and we're not looking for magic bullets, we're looking for true conscious breakthroughs to bring some level of peace and equanimity into the mind, and some level of strength and endurance and flexibility into the body and the mind too. You know, strength, endurance, and flexibility. These are mental attributes that we want to cultivate. These are physical attributes that we want to cultivate, and these are some of the tools that we can utilize to do that, guys. So putting everything in context, connect the dots. Everything is different. Every person is different. So you guys think about this. If you think this is something that you possibly want to use, you know, and you're one of my patients, you can ask me about it. We can talk about it. And if you're working with somebody else, another practitioner out there in the wide world somewhere, you know, these are the kind of things to talk about. So this is just the tip of the iceberg on a giant topic that needs more time and needs to be unpacked more. But, you know, just we're introducing this and kind of looking at this high level, making sure we had the proper context and orientation if we're going to do a deeper dive and get into this and consider this for ourselves or a friend or family member, stuff like this. But tremendous medicine can be tremendously beneficial. We should definitely 100% use it in the proper context. Okay, guys, that's the office hours for today. Adios for now. You guys have a great day, wonderful day. We'll see you next time, okay?